Welcome back to Little Rounds by Agaya. This is your host Amir, and we are in the second episode today. After we finished the first episode with our medical therapist at Agaya, Noura, Sally, and Asma, we spoke about the therapy and how is it important with all of parents and how they will be interacting with kids. And now, for today, we are going further in depth to speak with the first point that usually parents go or seek help from, which is the pediatrician or the doctors. So we are here today with Dr. Ahmed to speak more about what parents may seek out usually when they come first time with a doctor. But they not all the time they have the right approach, or maybe they are not coming in the right time, or maybe they don't know what milestones that it's there for kids and all that. So that's why today we will be here with Dr. Ahmed. Welcome, Dr. Ahmed, for the second session
Thank you.
Little Rounds by Agaya. And I think the best way to start is you can just tell people who don't know you a little bit about yourself.
Of course. So I'm a pediatrician with over 15 years of experience. I have worked in different fields of pediatric, general pediatric, developmental concerns, and I have managed different cases from routine child health care, nutrition, like different kind of infections, and going to developmental concerns, attention difficulties, and all other concerns where when parents come to me for and seek help for that.
Yes, so welcome again, and for sure all of us working with you, we are proud to have you with us. And I guess we can start our discussion with the most important, let's say, idea of like what is the most common concern that parents usually come to you with? Let's say from the age of 0 or 3 months up to 3 or 5 years old, because this is maybe the period that we are speaking about. Can you tell us some common concerns that parents have?
Yes, sure. So basically, beside all like general pediatric concerns which we see every day, nowadays developmental concern and behavioral issues are increasing rapidly, and a lot of parents they come with these kind of concerns and asking for help. And I think there is a clear reason for that, and it's because of the social media. Everyone is active in social medias. There are a lot of applications which are tracking their kids' growth, and of course all of that, which is we can look at it as a positive point, because early seeking help and early intervention is very, very good for children. And we will talk, I think, later about this issue also, which is very, very important. And luckily, we see a lot of, in compared to, let's say, 10 years ago, 15 years ago, parents are seeking help much earlier.
Well, that's good when you are saying that, but starting from this, that parents are starting from a little bit earlier. I think it's good if we can highlight for parents what are the non-negotiable milestones that if it's not reached, they need to seek help. Because, there's a lot of time parents always, consider anything that you need to go to doctor. So if we can, I know it's very hard and you don't like to, specify certain milestone, but what is the non-negotiable things that if a kid didn't reach, they need to seek help?
Yes, very good question, actually. So in medical terms, we have like a thing called milestone, which developmental milestone, which for every stage of development of the child, we keep a window. We say like from this time till this time, it could be normal, and not two children are even like each other.
Yeah.
But there are some certain red flags, we call it red flags,
Yeah.
which we want all parents and all families to seek help immediately. Well, when I'm saying the red flags, it doesn't mean that for sure your child has like some like concern or some like difficult diagnosis. We don't want to label them on that. But my point is at that stage you have to seek medical attention and seek help. And well, if there is nothing, they will reassure you. But if there is anything, always early intervention is recommended. Like, for example, if you see, I will give you some examples. Like if you see like the child is not interacting or not looking at you by like 1 year, 9 months, 1 year, is not looking at you, no interaction, he's not responding to, he or she is not responding to his or her name. Like for example, no crawling, no standing, or there is like extremely stiffness or floppy. Like all of these are things that we call it as a red flag, like not walking by 18 months, you know. These are like red flags, so immediately you have to seek help or take advice by the professional to reassure yourself, and if they need help, to get the help as early as possible.
Exactly. And now this is two questions actually I have to ask you, but I will put them all in one aspect to speak with you about it. It's like nowadays everyone considers that we can ask online or we can ask any AI or even Google, and that's something that 15 years ago or more than the 15 years ago started. It's not something new. However, speaking about that and having also the thinking that there is some milestones that everyone say wait and see. So let's say as if a kid is not speaking by 3 years old, yeah, wait and see. In Arabic they say that he's just shy and he will speak later. So what can you guide parents in that matter, like seeking help online or from non-professional sources, or even like listening to the common habits of their maybe families or aunts or mom and dad? What do you have input for that?
Exactly, very good point. Like as you mentioned, wait and see, it comes from two perspectives. Either they compare the child to other siblings or to someone else in the family, or they have a fear of diagnosis or of labeling. So these two are usually the common reason why they're going toward wait and see. Let's wait and see.
Yeah.
But it is always advised to if you have any concern and if your instinct is telling you, because you as parents are always with the child more than anyone else. So if you have any concern or if you are feeling that something is not as it should be, then we always advise to seek the professional help and advice. Because the problem with the social media, it has a good and bad effect. The good one, it's like it will aware you, it makes the people being aware, and it will help you to find out early. But from the other side, it might confuse you and give you wrong information. Because when a child comes to us as a physician or as a pediatrician, we completely listen to the parents, what they are saying. Then we take a lot of questions, and then we do our clinical assessment.
So, sorry to interrupt you for that, but that's because you are going to my next question. So I had to, so we can clear it more. So I think it's better that we really explain to parents what would you do as a pediatrician if a parent, let's say, come to you with a concern of my kid is not talking, he's 3 years old. What you will do? Some parents, are afraid of going to a doctor because they think that the doctor will start making for the kid, or telling him, please show me your tongue, or whatever it is. So I think it's good if we really explain them what is the process of your examination for the kid.
Yes. So basically, it depends on what kind of concern they have. So based on the kind of concern, we put it in the first medical context, and we ask a lot of questions, and then we do our clinical assessment. Based on that, if it's required to do more investigation, because our job as physician is first to rule out any medical condition that could be behind it.
Yeah.
If we rule out all medical condition and we found out that there is no medical condition, the child is simply like delayed in one particular area, what we usually do, we refer to the specific therapist for more assessment and advice. Like, for example, if the child is delayed in talking and in speech, what we usually do, we rule out the hearing problem or all other problems that could be, we ask several questions, even from before the birth, how it was pregnancy, delivery, and then after. And then we do our medical assessment. And if we found out everything is fine, hearing is fine, everything is fine, we refer to speech therapists. A speech therapist, they have their own assessment, which is much longer than what we do. Like, they are going in detailed assessment of the child for that particular concern. And then based on that, they will give their advice, like how they can help the child.
Okay.
And as early as this will be done, it will be more helpful and more impactful for the child.
Very good. So it's good that you said as early as possible. So last session, me and Noura, Sally, and Asma, we spoke a lot about early intervention. And early intervention by itself is a subject that is important for parents, because some of them say, no, I don't want to trouble my kid, or I don't want to trouble myself with that. Some of them, no, go really early and all of that. But I think it's better if we speak about the long-term reflection of an early intervention, like how much it's it's important for long term if you seek the early intervention approach as a parent.
Yes, again, very good question. Now, first, let me explain why we say early intervention. If you notice, for a child, for the head of an infant, or when the child is born, the head is, compared to other parts, is bigger. You see, the brain is bigger, but at the same time, if you touch the head, you will see that there is an opening which is called fontanella. We have anterior and posterior fontanella. So the brain during the first 2 years is rapidly growing.
Yes.
And because rapidly the brain is growing, it is the best adaptability time for the brain.
Yeah.
So, and especially the first 2 to 3 years, which we call it golden age or golden time for intervention. Because whatever intervention is needed, if it will start at this time, at early, the first 3 years, the impact will be much, much higher. And in the long term, we will get, not only the effect will be much better, but we will reach to the point we want much quicker.
Yeah.
Because the brain is it's too much adaptable. It's like it's growing. It's fast growing, and this is the goal. That's why they call it golden time, and that's why we say early intervention, because early intervention. That means we are using the time when the brain is developing and growing to learn or to teach the child, what is required.
What we can, if you can specify one or two or one mistake, that's my main question was, but if it's hard for you, you can do 2 or 3 mistakes. What is the one mistake that you face parents do as in general? And if you want to be specific about the society here in UAE, it's okay. If you want to speak in general for worldwide, it's okay as well.
We kind of touched it in our previous topics, but it's like I think one mistake that many of them, they say wait and see. That's one of the main mistakes.
You still believe that this is
exactly, because I always believe that to act early, and it's better than uh, later regret it, you know. Act early and help the child early. It's much better than later regretting that something, you know.
Okay.
Because always, as I said earlier, you have a better chance. Even if you think that if there will be nothing, the professional or the pediatrician will reassure you. Nothing, you are not harming the kid or the child, you know. So that's why we always advise that if you are having any concern, address it early.
Yeah.
You know, don't wait and don't
Yes.
say, okay, his brother when he was young also it was like this,
Yeah.
or like
Not to generalize in general.
exactly, not generalize. At the same time, we have a window, like for each developmental milestone, we have a window that we say, for example, from this age till age it could be developed. One might develop it at 6 months, the other one might develop it at 8 months. That is true. But always, if you have a concern and you have it persistently, like for 1 month, 2 months, you still have that concern, it's always advisable to seek professional assessment.
Okay. Speaking about professional assessment, also last session, we discussed the multidisciplinary approach. And we discussed how bringing the kid or the child to a multidisciplinary team is having advantage on just taking him to just a therapist, an individual therapist, and all that. In short, can you tell us your perspective about that as a pediatrician? Like, as a pediatrician, when you send or you refer to a multidisciplinary team, how you look at it differently than you referring to just a single therapist?
Of course, I'm much more comfortable to send to a multidisciplinary team. The reason is why, because many of these kids who have developmental delays or behavioral issues, it's not only isolated, it might be not only one isolated case. And when I'm sending to one specific, for example, if I have a speech problem and I'm speech delay and I'm sending to speech therapists, I'm quite comfortable that if I'm sending to multidisciplinary team, if the speech is checking the child and noticing any requirement, for example, for OT or for AB or for any other therapy services, she will refer and ask for the assessment.
Yeah.
So the approach would be like comprehensive and holistic approach, not fragmented, you know, and that is very, very important for me as a pediatrician, because then I'm comfortable, okay, I'm sending this, because sometimes in the clinic or in our office as pediatrician, we don't have time to check all aspects of developmental. We see, and maybe sometimes parents will not notice if something is minor. Like if not, for example, maybe they notice that the child is late in talking, but they did not notice, for example, fine motor problems that he has it.
Or maybe his behavior.
Exactly, or behavior. So some other small things, they might not have noticed it. And because I see the child as a pediatrician just for like maximum half an hour, it won't be possible for me also to pick it up, you know. And when I send to multidisciplinary team, so I'm quite comfortable, because if that therapist who is checking the child for nearly 45 to 1 hour, if she will notice anything, she will refer directly to the next therapist to be assessed and checked. And another thing is that when there is a multidisciplinary team, the approach would be like everyone will try to take a part. And as a whole, the treatment will be individualized, and it will be like a whole approach and comprehensive approach, you know, which is much more helpful and much more effective for the child.
Okay. As a final point, for all parents who are watching this episode with you, Dr. Ahmed, and feeling unsure that my kid maybe he's in the right milestones or no, or he's in the right developmental stage or no, what would you tell them, to all of these parents?
So first of all, considering the social media and all the information available in online, I advise them not to panic. Okay. seek advice and professional assessment as early as possible, because even if there is nothing, you're not gonna harm your child, and no one gonna label your child with anything if you are not sure. But from other point, if they need a help, even to make them develop that skill faster, it would be much more beneficial if they start early. So my last point is, don't wait and see. If you have a concern, we always trust what parents have as a concern, because they're the one who are most of the time with the kids, and if they have some concern, we always take it seriously. So if your instinct is telling you that there is something wrong or something is not right, please seek professional advice. You will not harm the child. You will help. If there is any, if the child needs help, you will get the help at the right time and with much more effect and much more sessions. And if it doesn't need, you will get reassurance and you are comfortable that there is nothing wrong with the child.
Well, thank you so much, Dr. Omed, for being here with us, and we appreciate your time with us, and for sure we are waiting for you for further more episodes later. Thank you, everyone. If you are a first-timer watching Little Rounds, please go and check our first episode and then watch this. Whatever next we will issue, because we have a lot of episodes coming. It's all about supporting parents and supporting their child development. You can always also follow us on our social media channels, that it will be in the description below. And thank you again for watching.